Hope Cook with DermCast Live. I meet so many interesting people at the SDPA conferences. I met Michael Rubio at the last conference, and I asked him to join me today to tell us about his PA journey. Welcome, Michael.
Thank you for having me.
Yeah, so I would love for you to tell our audience about your journey from being a PA to all these other things that take up your time. It's fascinating to me.
Yeah, thank you. Yeah, my journey on becoming a PA is really based on my mom. She was a nurse practitioner. She worked in the ER she still currently works in the ER for 35 years.
Wow.
She started off as a nurse. Before that, she was a bartender, and she really changed my brother and I's trajectory. And we grew up with hearing her war stories over the dinner table, and she became a nurse, and she became a nurse practitioner. She chose the ER because she just loves helping people in more of the acute phase. And she's the best storyteller. So as she told stories over the dinner table, my brother and I were just amazed by the stories of what she did day to day. And I just identified with her caring nature, and I slowly found myself in helping people in school. And I used to carry Band-Aids in my backpack to help people whenever they scrape their knees. So I just loved taking care of people, and that took the form of when I was in college, learning about the U.S. healthcare system and learning that we need, to help it forward and modernize it and to meet the demands of the current age. And I just decided to go back to PA school, and it just fit with more of my background.
Sorry to interrupt, what was your background? Like, what did you study in college?
It was environmental health science, and I chose that one because I love the environment. I love how we can do to improve the environment. So it was a very much mix between medicine and environment.
Mm-hmm. And you mentioned thinking about healthcare in college, which I think is impressive, because I certainly was not thinking about global healthcare or anything like that in college.
Yeah, it's funny. I've led a lot of initiatives in my career. I led like a better lunch system within my first in a cafeteria that I was a part of. It was just our school didn't have free lunch, so I felt like I'm always on this side of like, let's just change the system and change the way it works. So I led an initiative to offer free lunch within our school. That kind of led an initiative to help dispel plastic bags within our local community, so that we could move away from plastic bags to ultimately what I do now, which is helping practices get on more modern technology to meet our patients better. So that's what I do now. And so I've been a PA specifically in derm for almost 10 years, and I love being a DermPA, but it really does become to the point where you hit a plateau within your field. And the next step for me was, how do I better reach my patients? How can I better meet their needs? And that developed this platform to help me do that.
Yeah,
so
tell me about the plateau. Like, how long had you been in dermatology, and what did that look like?
Yeah, got my start out in New York City. Dr. Bobby Buca trained me. He now owns 40 offices in New York City. He's a private derm practitioner who started with one office. I came to him about when he had 2 or 3 offices, and I just made a cold pitch to him that I was an eager PA willing to learn. And he fortunately trained me in derm and taught me everything he knows. And that was an amazing experience. I got into working with him and just saw, right out the gate, 30, 40 patients for the first 3 of the years. And it was then where I started getting my own flair. And, there's other things in industries where you have 10,000 hours before you become a master. Well, medicine is like 10,000 patients.
Yeah.
So you see 10,000 patients, you start realizing, okay, yeah, here's how I do things, here's my approach. I'm obsessed with how do I explain this so that they can get it? How do I use the most simplest terms so that they can improve their lives?
Yeah.
So that's what I'm obsessed with, explaining atopic dermatitis and all of its intricacies in a way that they can just understand, or psoriasis. So that's kind of what I'm more interested in, and so that's what I'm delved into. And then I became a part of the SDPA. came about it actually hearing you and Rob on Dermcast podcast. And I just fell in love with the education piece. And that's what led me into more of the network, which has been professionally life-changing because getting the support of your peers is so important, and connecting with them and building off of each other. It's just, it makes us more effective in our clinical practice.
Well, what struck me about you was that you just dive right in. And if you don't know something about a subject, you're just like, oh, well, I'm going to do it. I'm going to figure it out.
Thank you. Yeah, thank you. Yeah, that's actually a strength and a little insecurity because I do get anxious and get insecure going up to people and just creating that spark or creating the opportunity. But I've learned in clinical practice and patients and also just in professional development, the more you expand your surface area, the opportunities will come. So as long as you keep talking to people and meeting people and just expand your surface area, those opportunities, those people that will actually you'll work together with and collaborate with, those naturally come. So I've learned to just keep doing it and keep putting myself out there.
Do it even if you're scared.
It has not failed me, but yeah, I'm always scared.
I love that. Not that you're always scared, but thank you for admitting it.
Yes, I know it's a little bit of anxiety, but I've learned to embrace the anxiety. It makes it kind of as part of the territory.
Yeah. Okay, so I want to hear more about how did you go from seeing patients all day to thinking of, all right, how can I improve technology in my medical office or any medical office?
Yeah, it really started during COVID. 2020 hit in February, March 2020. We all know where we were when we decided we couldn't go into offices and we had to meet the demand of our patients in a unique way. The practice I was working with just had no technology awareness at all. And I grew up with the internet. I'm a millennial, so I kind of took that role and created a whole telemedicine program for them. And I'd realized that as I was doing that, nobody knew what to do in that stage. And over the course of 3 years, we built a platform to meet that demand. And it basically, the platform is helping people understand, clinicians and medical practices in general, that we can do a lot with opening up different channels to communicate with patients. Most medical practices in the US, and I would say the world, just have a phone number. And when a patient needs help acutely, they call the number, they're on wait, they talk to a provider, maybe they get appointments. It's really, and then the average wait in America for a dermatologist, medically is 22 days. Okay. 22 days is the average wait, 4 days for a cosmetic appointment for derm. So when we start taking that we really need to meet the demand of our patients and get them in the clinic quicker, this takes the form of going outside of the phone call. It's web-based appointments, it's opening up text-based appointments, it's opening up live chat, and being there for our patients. Our healthcare industry, there's the most loving and caring people that I've ever met, but our industry as a whole is not known for our loving and caring approach. We have a hard time translating that. And when you go to hotels like the Ritz-Carlton, they know everything about you, and they excel on that concierge hospitality type care, and we're lacking that in our healthcare industry. So I'm just passionate about how do we create technology, how can we use technology to bring in that care that we give in our rooms, and how do we approach that? And one basic way is just being available to patients, just being available and just responding. And the responding is within 5 minutes, within 10 minutes. They reach out, we have an adequate system to respond.
What do you say to providers, though, who are like, I do not want to be available in 5 minutes? Like, I'll get back to you this afternoon.
It's a common question, and a lot of the training is not with the providers, actually. It's training our front staff. They're the front lines, and a lot of what we do is education, is educating the front desk. The front desk is actually, they want to do more. They want to be a part of the medical practice more, but they really just find themselves answering phones. And one person can answer one call at one time, but when you open up different channels and they can be a part of that support system, it not only activates our front desk, but it engages them to not only just be a phone call to just give a message. It allows them to do more and be a part of the whole system, and it makes them feel more part of the patient's journey.
Yeah.
So it's really about educating our front desk, which is our front lines,
Yeah.
And our medical assistants, engaging them, making them more active. It's not all about us as clinicians, although we do serve an important part, but it's activating the whole team.
It's fascinating because so many of us who went to PA school, our brains are not even thinking, like my brain is consumed with seeing patients, dermatology. I'm not thinking about appointment making or technology or how do I streamline this. How does your brain do that, Michael?
Yeah, there was a point in my career, it was like the 5-year mark, where I was taking on too much of the role. And I found myself in the room for way too long.
Yeah.
And my MAs just sitting in their room waiting for me to get done. I didn't activate them. And a big part of your maturing as a clinician is activating your team.
Yeah.
How do you communicate with your MAs so that they can assist you? How do you communicate with your front desk so that they can better prevent problems before they happen, or help you out as a clinician? So that's educating MAs, educating your front desk team about how to communicate with patients. That part has been the most fun for me because, yes, I can do the medicine part, but it has allowed me to activate my MAs and front desk, and that makes my life easier.
Yeah.
That makes our clinician life easier. That makes our workload easier. It allows us to focus on the actual medicine and not necessarily explaining how to apply something, which our MAs are more than able to do.
Yeah, and I don't know if you found this to be true, but the more I add in that activates my creativity and the right part of my brain, it has a paradoxical effect where it seems like that would stress me out and take more time and energy, but instead it gives me more energy.
Yeah, yes, 100%. When we are going beyond the clinical work, which is very much important, and we should study and address those and understand that, but finding those areas where you are curious in and going in that route, you'll not only spend hours after your clinical shift, but it just fuels you to kind of go to that next level.
Yeah.
Clinicians, we need to know medicine inside and out. We need to know what's safe. We need to know how to communicate that. But that's like step one. And step two, really, in your clinical journey is how do we deliver that in a way that really translate into real change into our patients' lives. And for me, I've just found that when I can do that through text, when I can do that through live chat, when we can do that through texting articles and informations post the visit, it's like I'm a friend. I just open up another channel that their patients are not used to.
Yeah.
And it makes them want to improve. It makes them use the medications that I'm prescribing, the treatment plans that I'm giving. It makes them more eager to do it. And when it's not working, they can just message me, and we can have that whole process in place so that we can feel that and find something different.
Yeah. Oh, this is such an interesting conversation. For people who are like, I need to check out this guy, where can they find more information about you?
Yeah, that's a good question. So the main website is called Plat. It's plathealth.com.
P-L-A-T?
Yeah, it's P-L-A-I-T.
Okay.
Yeah, health, it means braid. It's just taking multiple things and coming together.
Okay.
And so that's plathealth.com, but you can also find me on social media. I'm on Instagram, LinkedIn. And if you're curious, or if you ever want to learn about how to improve telemedicine, specifically technology in your practice, definitely let me know, because I'm always interested in helping practices and learning what we can do, what providers are wanting, and how can we improve to meet that demand.
Yeah, thank you for coming today and talking to us.
Of course, I'm honored. Big fan of you, Hope, and I just, I'm happy to be here.
Thanks, Michael. Hope Cook with DermCast Live.